let's talk about the HMOs offered by the University of California. HMO stands for Health Maintenance Organization. And what that means is that an organization is prepaid to maintain your health. And that organization is going to be a medical group, a local medical group that has contracts with doctors and nurses and labs and imaging centers and might have its own hospital or contract with a hospital. It's an organization that gets together to negotiate for prepayment with these HMOs. Now, the insurance company is going to prepay a monthly per capita fee called capitation to only one medical group per person per month. If a medical group is capitated to take care of you, they are responsible for your care for that month, and they're known as your primary medical group. Now, each family member can have a different group and a different primary care physician, but this is how HMOs help you avoid paying for insurance. It's brilliant. Instead of paying for insurance, you're paying an insurance company to pay a medical group, then you get most of your care through that medical group and reduce the cost of insurance. And you're out of pocket. So you as an HMO member choose a primary care physician or PCP who acts as a gatekeeper to care through that medical group. You need this gatekeeper role because you need that PCP to make sure that you're going to specialists who are also already part of that medical group. If you need to be referred out of the medical group can authorize that. But they're going to avoid that if they can, because that's going to incur additional cost. The idea here is that the insurance company is going to prepay this group. The group can take on the risk for your care because they already have their own medical providers and hospitals and whatnot. So you got to get all your care through your group. The group that you choose, the PCP and group that you choose, determines in advance the specialists and hospitals you'll have access to. So make sure that you choose medical groups carefully. Of course, there are exceptions. You're still insured against emergencies. And the cost of prescription drugs and some other things. But for most things, you have to get your care through the prepaid group. But of course, if you're in an emergency, dial 911 or go to the nearest hospital. Don't drag your bleeding body to your medical group's hospital if there's another hospital that's closer. But if you do get care, make sure, emergency care, be sure to let your primary care physician know immediately. Because what you're not covered for is follow-up care outside the medical group. So they may need to arrange to bring you to providers that belong to the medical group. So you've got to let the group know. And the way you let the group know that you've had emergency care is to contact your PCP's office. Now, about choosing that primary care physician, remember, everybody in the family can have a different doctor and group. But for everybody, that primary care physician must be within 30 miles of home. So make sure to choose a PCP that is within that range. If you live in Davis or Sacramento, you can't have a PCP in San Francisco, for example. That's too many miles away. It's a consumer protection. HMOs are licensed to cover you by limiting you to a handful of doctors in one geographic location. So by having a PCP within 30 miles of home, we're increasing the odds that you will actually be able to get care in a timely manner without delaying it unnecessarily because you're too far away. Geography is destiny with HMOs. So it's important that you have a PCP in your geography. Now, if you want to change primary care physicians, all you have to do is call your plan. Usually, if you call an HMO in the first half of a given month, you'll have the new PCP effective the first of the following month. Now, one thing about HMOs compared to PPOs especially, there's no out-of-network coverage. In a PPO, you can go to any preferred provider. You can go to any provider that isn't even preferred. That's called going out of network. So you do have some out-of-network benefits with a PPO, but not with an HMO. With an HMO, out-of-network coverage isn't there. Don't get me wrong, you're still covered for emergencies, urgent care more than 30 miles from home, and for anything that your medical group authorizes in advance. I mean, if your medical group wants to send you to Stanford, they can do that, but they have to authorize it. It's up to them, not up to you. By the way, when I talk about emergencies and urgent care, what do I mean? Well, emergencies, you could think of it with this rule of thumb. An emergency is something that an insurance company would consider emergent. Things like uh, services that you need because you are in a life-threatening, limb-threatening, organ system-threatening, or extremely painful situation. Like a broken leg is not going to kill you, but it's going to feel like it's going to kill you. So it would be covered. I do not have problems with our plans paying for emergency care. That's really an emergency. Urgent care is a little more of a gray area. Urgent care would be care that if you don't take care of it, it will become an emergency. So urgent care, you got to get through your primary medical group if you're within 30 miles of the group. But if you're out of area, if you're more than 30 miles away, you're likely able to go to any urgent care center. Feel free to clarify that with your medical group and your plan, because sometimes they contract with networks of urgent care centers. So HMOs are brilliant at helping you avoid paying for insurance as long as you're willing to be limited to a handful of prepaid doctors. There are several advantages to this model. First of all, you have low, predictable, easy to understand, flat dollar copayments. If you're in a PPO plan, you usually have no idea what you're going to pay when you go to the doctor, because with most PPOs, you have to meet a deductible, which is what you have to pay before the plan pays anything. You don't have deductibles with an HMO. If you're in a PPO, not only do you have to meet a deductible, once you've met it, you have to pay a percentage for your care. So you're really paying 100% for your care until you meet your deductible. Then the percentage that you pay, known as coinsurance, goes down to usually 20 or 30%, something like that. You don't have to deal with deductibles or paying 20 or 30% with an HMO. You're going to pay a flat dollar copay when you go to the doctor. You pay it and you're done. And you don't have to keep track of medical bills like you do with a PPO. HMOs offer significantly lower financial liability. When we get into the out-of-pocket maximums for these plans, you'll find that if you're in an HMO, your out-of-pocket maximum is either $1,000 per person per year or $1,500 per person per year. That is far, far lower than our non-Medicare PPO plans. If you don't have Medicare and you have a PPO, your financial liability is going to be over $6,000 per person per year. It's night and day different. And of course, because you have to do everything through your primary care physician, that encourages you to develop a relationship with that PCP. Hopefully develop a good rapport so that you have more productive conversations about your health and you can better stay in compliance with your treatment plan and your medications and all that. So those are several advantages of HMOs. Of course, there are downsides to the HMO model. First of all, the geographic limitations. HMOs are only available in about half the counties in California. So if you're any place rural or you're out of state, an HMO isn't going to be available to you. And you must choose a primary care physician from the network of medical groups that your plan offers. And your plan may not offer your favorite medical group. The options vary depending on where you are and what plan you have. And most specialty care must be referred by your primary care physician. You can't just go straight to a specialist. And not only does that PCP need to get your referral going, they have to get it authorized. So you need authorized referrals where the PCP initiates the referral and the medical group authorizes it before you can actually go to the specialist. Now, some medical groups will let you self-refer to ophthalmologists, and most will let you women self-refer to OBGYNs, but for the most part, you got to go through your PCP gatekeeper to get to specialty care with an HMO. And keep in mind that you are choosing in advance when you choose your PCP and group. You are choosing in advance the specialists, hospitals, labs, the care that you're going to receive in the future, having no idea necessarily what your future medical needs may be. So be sure to choose wisely, because you're going where the group says you're going. You get to choose the PCP and group, but beyond that, you don't have a lot of control. Also, HMOs have no out-of-network coverage, unlike PPO plans, except for emergencies, urgent care centers when you're more than 30 miles from the medical group, or if the medical group authorizes you to go outside the group. Of course, you could do that, but that's up to the medical group. It's not necessarily up to you. So you essentially have no out-of-network coverage. In fact, you may need to get permission from your primary care physician's office before using urgent care. Some medical groups don't have their own urgent care centers, so they contract with community urgent care centers. And if you don't know where to go and it's urgent, that could be a problem. So keep in mind that you might have to call your PCP's office. They should have somebody answering the phone, even if they're not open, who can get you some direction. But some medical groups will have their own urgent care center, and it will be simple. Some will not. Here's an example. UC Davis Medical Group does not have its own urgent care center. It has its own emergency room, of course, the UC Davis Medical Center, but it doesn't have its own urgent care center. So you'll want to check with your PCP's office if you're a UC Davis patient. Now, if your UC Davis primary care physician is based in Davis, California, you are allowed to self-refer to the Davis Urgent Care Center in Davis. So that's an exception for the UC Davis Medical Group for people who have PCPs in Davis. If you have a UC Davis PCP in another town, you're going to need to find out from the group, from your PCP's office, where you should go for urgent care, because they contract with community urgent care centers. What do you pay for care when you're in an HMO? You pay low, flat co-payments. Office visits with your PCP or a specialist or urgent care is going to be $30. Make that $20 for chiropractic or acupuncture. If you have an emergency, it's a $125 copayment. Unless you have a Medicare HMO, that would be Kaiser Senior Advantage, then your copay is $65 this year, going up to $100 next year. So 2026, the Kaiser Senior Advantage ER copay is going up to $100. Emergencies are covered worldwide, and if you are admitted to the hospital through the emergency room, you just pay the inpatient hospitalization copay of $250. Unless you're in Kaiser Senior Advantage, then that $250 copay is climbing in 2026 to $350. Be aware of that. Outpatient surgery is $100. Behavioral health benefits are essentially the same as they are for medical. So it's $30 for outpatient mental health or therapy sessions or whatever. Behavioral health inpatient, $250. Unless you have Kaiser Senior Advantage, then it's going up from $250 to $350 for a inpatient hospital copay, whether it's medical or mental health. Speaking of mental health or behavioral health, here's how you get care through an HMO. If you're in Kaiser, you can go through your primary care physician to a Permanente mental health provider or to a provider that Kaiser contracts with, or you can go to Optum providers in the community. Optum is a United Healthcare company that UC pays separately from Kaiser to cover you for mental health services if you have non-Medicare Kaiser. UC does this, even though it's an extra expense, so that you have options in the community outside Kaiser in case you can't get what you need from Kaiser. That's not true when you have Medicare. If you have Kaiser Senior Advantage, your only option is to go through your primary care physician. So you can only go through Permanente providers or providers that Kaiser contracts with for mental health. Now, let's say you have the UC Blue and Gold HMO, HealthNet. You're going to go through not your medical group, you're going to go through HealthNet Behavioral Health, formerly known as MHN, Managed Health Network. HealthNet Behavioral Health is a subsidiary of HealthNet that specializes in mental health care. Now, when you're calling Optum or you're calling HealthNet Behavioral Health, you can ask them to find you a provider who is accepting new patients. It can be difficult to find providers on your own, so put the onus on them to find you a provider by calling and asking for them to find you a provider who meets your criteria, who is accepting new patients. But if you want to search for providers, here are the websites to use. For HealthNet Behavioral Health, you're looking at healthnet.com/UC. For Kaiser, you're going to go to Kaiser's new UC-specific website, which is choose.kaiserpermanente.org/UC. Now, if you're a Kaiser member who doesn't have Medicare, you can go to Optum. Optum's website is liveandworkwell.com, and you can either register as a member or you can use the UC access code 11280. Then you can search for providers. Well, how much do you pay for prescription drugs? Let's take a look at the copayments for the non-Medicare HMOs when it comes to prescription drugs. We're looking at a 4-tier pharmacy copayment structure here, with Tier 1 being generics, Tier 2 being brand name, Tier 3 is off formulary, and Tier 4 is those high-cost specialty medications, usually self-injectables. So Tier 1 generics. A generic drug is manufactured by multiple manufacturers, so there's competition on price. Generics are always less expensive than brand name drugs. Brand name drugs cost more because usually only one pharmaceutical manufacturer makes that drug. So there's no competition, and that company has to make up for all the research and development costs that they put into developing that drug. The formulary is the list of drugs that the plan prefers to cover because those are the drugs that save them the most money and meet the various therapeutic categories that are needed. Tier 3, non-formulary. This doesn't really apply to Kaiser, but if you're in HealthNet, the UC Blue and Gold HMO, and your doctor prescribes a non-formulary drug, that's a drug that's not on the list, you can get it covered. You'll likely have to get your doctor will likely have to get prior authorization before you can get it. But the idea here is that with HealthNet doctors take many, many, many different types of insurance. They can't possibly know every drug formulary out there, so they won't know what's on formulary and what's off formulary per se. So having this non-formulary tier makes it a little easier. It gives you time to maybe try to save yourself money by circling back to that doctor after you've been charged $50 and try to get something that is on the formulary that will do what you need it to do. Kaiser doesn't really have that need because Permanente doctors really only deal with one insurance, Kaiser. So they only deal with one drug formulary, and they know their formulary. So they don't prescribe off it unless they absolutely have to. And if they do, you're just going to pay the $10 or $30 copays for generic or brand name drugs under Kaiser. So generic drugs are on the formulary, and they're going to cost you $10 for a 30-day supply under either HMO. Same with the Tier 2 brand name drugs. Brand name drugs that are on the formulary, $30 for a 30-day supply. Tier 3 doesn't apply to Kaiser, but for HealthNet, you're going to pay $50 for a 30-day supply. Tier 4, those expensive specialty medications, with both plans, you are paying 30% of the cost of that drug up to a $150 per month copayment. The more expensive the drug is, the more you pay. Don't be surprised if some medications require prior authorization. Now, especially if you're in HealthNet, some drugs, especially expensive or dangerous or drugs that require lots of monitoring, your plan is going to require prior authorization. So your doctor doesn't just need to write a prescription. They also need to obtain prior authorization so that you are covered for that drug. So just be aware, some medications require a prescription and authorization, and sometimes your doctors won't know it. So sometimes you'll find out at the pharmacy and have to circle back to your doctor. Now, there's a way to get 90-day supplies of your maintenance medications for 2 copayments instead of 3. That saves you a third. Through HealthNet, the UC Blue and Gold HMO, you need to go through UC pharmacies like the UC Davis Pharmacy on Covell in Davis, or the UC Davis pharmacies at the UC Davis Medical Center in Sacramento. Or you can use local CVS pharmacies, or you can use mail order, and that mail order is going to be through CVS Caremark. I should point out that if you have Health Net, the UC Blue and Gold HMO, and you're going to get specialty medications, sometimes you can't get 90-day supplies of those. They're very expensive. And sometimes you also have to get them through special pharmacies. So if we're talking about specialty medications, you're going to want to get those from UC pharmacies or whatever pharmacy or medical group or Health Net requires. They can be special when you're taking drugs that can cost $5,000 a month, that kind of thing. But in general, to save a third on regular maintenance medications, this is how you do it with Health Net. For Kaiser, the only way to get a discount is to use their mail order pharmacy program. Kaiser does their own thing. Kaiser is their own pharmacy benefit manager, as far as I know, and they will give you a 100-day supply of maintenance medication for 2 copayments if you use their mail order program. I talked about this a little earlier, but here's a chart that shows you the out-of-pocket maximums, the maximum copayment liability, if you will, for the non-Medicare HMOs. So on our left here, we have the UC Blue and Gold HMO Health Net. It's $1,000 per person or $3,000 per family. It is artificially inexpensive to use HMOs. I mean, you could have had $1 million worth of medical care, and the most you pay in a year is $1,000. So it's very inexpensive to use HMOs. If you have Kaiser, it's a little more. It's $1,500 per person, but it's also got that $3,000 family cap on what you pay for prescription drugs. Understand that the Kaiser out-of-pocket maximum does not include Optum copayments for behavioral health. Now, the Health Net and non-Medicare Kaiser out-of-pocket maximums included medical, mental health, pharmacy, everything. Not so when we get Medicare involved, because Medicare Part D as in drugs has its own separate out-of-pocket maximum. So here we have the Kaiser Senior Advantage medical out-of-pocket maximum, which is, again, $1,500 or $3,000 per family. But this time, this just includes medical and mental health, not the pharmacy copayments. The pharmacy copayments have their own separate out-of-pocket maximum. And that separate Kaiser Senior Advantage pharmacy out-of-pocket maximum is $2,100. So that's your separate additional out-of-pocket maximum for prescription drugs. Now, I don't know anybody who has actually spent that kind of money on drugs in Kaiser. And the reason is, with these Medicare Part D drug plans, oftentimes what you spend in your little copays for $10 or $30, plus what the plan spends on drugs, both count towards the out-of-pocket maximum. So you may only pay $10 or $30, but Kaiser may be spending hundreds on drugs that you're not even aware of necessarily. Those hundreds of dollars may be counting towards your out-of-pocket maximum. I suspect that you will never come close to paying $2,100 under our Medicare Part D drug plans through Kaiser or otherwise. Well, we discussed in general the HMOs and the copays and some of the coverage and the out-of-pocket maximums. Now let's get into some of the little differences between the plans so as to help you decide between them. For example, Health Net, the UC Blue and Gold HMO, unlike Kaiser, it offers multiple local medical groups for you to choose from throughout urban California. Now, in the Davis-Sacramento area, you will not find Sutter or North Bay, but you will find UC Davis, Hill Physicians, Woodland Clinic, Mercy, some other medical groups. Health Net also offers health coaches such as nurses, respiratory therapists, and dietitians. They also offer nurse case managers that you can request. Now, if you have a complex medical need, obviously. Now, with Health Net, because they offer multiple medical groups, Health Net needs to know who you want them to prepay. When you first enroll, you may not be able to choose. If you can, great. If you can't, they'll randomly assign a doctor for you. But what you would want to be sure to do is check your ID card. Make sure the correct primary care physician is listed and the primary medical group that you expect is listed. If it isn't, be sure to call HealthNet right away to get that resolved. HealthNet also offers a Quit for Life smoking cessation program, a Share Care weight loss and management program for people with diabetes and certain heart risks that includes a wireless scale and services in Spanish. I believe that wireless scale communicates with your doctor. They also offer telehealth no copay consultations 24/7 through Teledoc. So you can get Teledoc virtual visits 24/7 through HealthNet for free. They also offer Teledoc Mental Health, which is a mood improving, I believe it's an app. It's not just a virtual visit with a provider. They also have a mood improving app that you can use called Teledoc Mental Health. With HealthNet, hearing aid coverage is limited to 2 aids every 36 months. There is a $2,000 benefit max. They give you access to CVS Minute Clinics if you happen to be near any. There aren't that many in the Sacramento area, but there are some, and you can go there for $30 a visit. So there's an urgent care solution for you if you're a HealthNet member, regardless of medical group. Allergy shots are $30 per visit. Their pharmacy benefit manager is CVS Caremark, and CVS Caremark is their mail order pharmacy program. When you call the number on your HealthNet ID card, you're actually reaching a UC dedicated customer service unit within HealthNet. They should know the UC HealthNet plan, which is nice. And if you want to know more about HealthNet in general, you go to healthnet.com/UC for UC specific information. Now remember, if you have HealthNet and you're covering a family member that is over 65 and has Medicare, they don't have HealthNet. They have the Medicare Partner Plan UC Medicare Choice through United Healthcare. This also means that if you have HealthNet now, but you're going to turn 65 soon, you're going to want to be sure to call us 3 months in advance of you turning 65 so that we can help you enroll in the UC Medicare Choice Plan through United Healthcare, because that's the partner plan matched up to the UC Blue and Gold HMO. Now let's talk about Kaiser and its Medicare partner plan, Kaiser Senior Advantage, and kind of compare and contrast the two. First of all, the interesting thing about Kaiser is that it is the original HMO. My understanding is that back in the day, Henry Kaiser, the industrialist, started prepaying some doctors that worked near Permanente Creek. And that was the first prepaid medical plan. And since then, Kaiser Foundation Health Plan Incorporated contracts with one large group, and I mean really large. There are 2 Permanente medical groups in California. There's the Permanente Medical Group of Northern California, which is Bakersfield North, and there's the Permanente Medical Group of Southern California. So when you have Kaiser, you don't have a choice of groups. You get the group that you live in, Northern California or Southern California. And that means if you have a problem with the group, you can't change groups. You are still in the same group. It's called a closed panel HMO. Kaiser members must use Permanente doctors, Kaiser hospitals, and Kaiser pharmacies. So when you choose Kaiser, you cut yourself off from most of the doctors, pharmacies, and hospitals in the country. But you can use all the Permanente and Kaiser services, which are often in one place. Kaiser likes to provide under one roof care, where their clinics include labs and imaging and pharmacies, all right next to their doctor's offices. So they try to make it efficient. Kaiser is available in most of urban California. You may read in the Open Enrollment booklet that it's available in Washington, D.C. also. It's not unless you are a UCOP employee who works in Washington, D.C. So tune that out if you're a UC Davis employee or retiree. Kaiser members use the My Health Manager mobile app to access their medical records and make doctor's appointments and whatnot. A couple of other apps are Calm and Headspace. Those are behavioral health tools that you can download apps for free if you're a Kaiser member. Kaiser members can get 30, 60, or 100-day supplies of their medications at 1, 2, or 3 times the applicable copay. But they have to use Kaiser pharmacies, right? But remember, if you want to get a 100-day supply for 2 times the applicable copay, you need to use Kaiser's mail order program. Now, Kaiser service areas in California are in Northern and Southern California, as I mentioned. They also have a service area in the Washington, D.C. area they call the Mid-Atlantic. They also have service areas in Georgia, Colorado, and parts of Washington and Oregon and Hawaii. But we don't have access to, we don't contract with Kaiser except in Northern and Southern California for UC Davis employees and retirees. But let's say you're in another Kaiser service area and you need urgent care. Well, you can get visiting member services in other Kaiser service areas by contacting Kaisers in other service areas, which is great. Now, let's say you're traveling and you're not in a Kaiser service area at all. Kaiser actually contracts with a Cigna network of urgent care centers, as well as minute clinics and concentric clinics, where you may only pay your normal urgent care copay if you were to use those network providers out and about. For details on Kaiser's travel benefits, take a look at kp.org/travel or call the number you see here on the slide. Now, Kaiser does have a new UC-specific web address. That's why it's in light blue here. It is choose.kaiserpermanente.org/UC. Now let's discuss Kaiser Senior Advantage, not regular Kaiser, the Medicare version of Kaiser. Medicare members must sign their Medicare benefits over to Kaiser. Medicare pays Kaiser to take care of you, then you use Kaiser for everything. It's an Advantage plan. Your ER copay is going from $65 to $100. That's the new copay for next year. Your inpatient hospital copay is going from $250 to $350 next year. Again, that's new for 2026. But Kaiser Senior Advantage members get access to free fitness clubs through the One Pass program that people in regular Kaiser do not get. They also have a richer hearing aid benefit. Regular Kaiser pays $1,000 per aid per ear, but Kaiser Senior Advantage bumps up that coverage to $2,500 per aid per ear. It's a really nice hearing aid. It's a $5,000 hearing aid benefit every 36 months. If you're a Kaiser Senior Advantage member, you also get a $150 eyewear allowance at Kaiser's optical departments every 24 months. Now, people tell me that Kaiser's glasses can still be expensive even when they're $150 off. So you might still want to buy a vision service plan during open enrollment. But this is something nice that Senior Advantage members have access to that people in regular Kaiser do not. Now, I realize that this page might be a little busy, but I think it's important for people who are going from regular Kaiser to Senior Advantage to know the little differences between the two. So on our left, we have the non-Medicare Kaiser. On our right, in red, of course, the Medicare Senior Advantage. First of all, the differences in out-of-pocket maximum. They both have $1,500 out-of-pocket maximums. But remember that Senior Advantage has the separate prescription drug out-of-pocket maximum of $2,100 due to Medicare Part D, as in drugs. When it comes to ER copayments, when you're in regular Kaiser, your copayment is $125. Your inpatient hospital copay is $250. But when you're in Senior Advantage, the ER copay is $100. The inpatient hospital copay is $350. Regular Kaiser has a prescription drug specialty tier of 30% up to $150 a month for those high-cost specialty drugs. Senior Advantage does not. You'll probably pay just $30 for a specialty drug under Senior Advantage. The hearing aid allowance is different. It's $1,000 if you don't have Medicare. It's $2,500 if you do. Eye exams are $0 if you have regular Kaiser, but $30 if you have Senior Advantage. But allergy shots are $5 if you don't have Medicare, $3 if you do. There is a $150 allowance towards eyeglass frames and lenses every 24 months if you have Senior Advantage. You have no such allowance if you don't have Medicare. And there are some differences with the acupuncture and chiropractic. When you have regular Kaiser, you use the American Specialty Network of chiropractors and acupuncturists, and you can self-refer. But under Kaiser Senior Advantage, there is no American Specialty Acupuncture. You only have Permanente Acupuncture. Technically, you still have American Specialty Chiropractic because as far as I know, there are no Permanente chiropractors. But under Senior Advantage, you have to get permission. You have to go through your PCP first to go to one of those American Specialty chiropractors. So it is a little bit different. Remember that if you have regular Kaiser, UC is paying for additional behavioral health benefits through Optum for you, which we don't do if you have Senior Advantage. But if you have Senior Advantage, you can go to fitness clubs through OnePass for free. That compares and contrasts the two. That's the end of the HMOs. Next up, we'll talk about UC's PPOs.